The Department of Justice announced this week that 11 more doctors have been charged in a wide-ranging opioid investigation accused of pocketing patients' money in exchange for writing extra prescriptions. 87 medical professionals have now been charged in all, and as we've discussed before, thousands of state, local, and tribal governments, including ours, by the way, have filed lawsuits against the makers and distributors of these highly addictive drugs. But while the legal cases play out, there's a growing debate about what the priority should be in treating those already addicted, whether it's easier to access treatment medication or training doctors to better understand the disease first. Stephanie Leydon has more.
Good girl.
Becoming a dog owner in many ways helped Paul Bowman turn his life around.
Having a Great Dane or a dog was something I had to show up for.
He spent years unable to care for anything or anyone because he was addicted to opioids.
I started using because I had a surgery, and then I got hooked on painkillers.
So it was a prescription medicine a doctor gave you.
And then 3 years later, he was still giving me, even though the pain was long gone.
That's a big part of how the opioid crisis started, doctors overprescribing opioid-based pain medications like OxyContin. Bowman finally got into long-term recovery with the help of another prescription. He now takes something called buprenorphine.
There's this idea that people who are dealing with addiction are replacing one drug with another. What's your response to that?
Oh, it's not at all the case. I mean, you don't... I just took a buprenorphine, this morning, and I did not feel anything except I didn't feel the compulsion to use drugs.
Within the medical community, there's widespread agreement that buprenorphine, also known as Suboxone, works.
When I think of the medications that I prescribe for other illnesses in primary care, of chronic illnesses, buprenorphine is really nearly miraculous.
Laura Kehoe runs an addiction treatment clinic at Mass General, and she wants the rules around buprenorphine to change. Unlike, say, OxyContin, the opioid painkiller, which any doctor can prescribe, buprenorphine is considered a controlled substance. Under federal law, doctors need a waiver, which requires 8 hours of training.
And really, the waiver in itself just sends the message that this is a difficult illness to treat and it's a difficult medication to prescribe, when in fact, it's really quite simple.
But at the American Academy of Addiction Psychiatry, CEO Catherine Cates-Wessel says the training requirement isn't what stops doctors from prescribing buprenorphine.
I've had doctors and other prescribers say, I got the waiver, now what do I do? And I don't want them coming in my office and stealing things and yelling at me.
Treating opioid addiction, she says, is different than other chronic conditions.
If you don't have access to behavioral health, it can get complicated. How do you handle it? You've kind of set yourself up for failure and the patient up for failure. And I'm afraid that if people throw away the waiver, they're going to miss that very thing they need, is education.
Here you go. You ready?
Paul Bowman agrees more addiction treatment training is needed. But he says so is access to a medication that can change and even save lives. Stephanie Leydon, WGBH News.
Government data shows only around 7% of doctors prescribe buprenorphine. There are bills in both the U.S. House and Senate with bipartisan support that would get rid of the waiver requirement, which 39 attorneys general have signed on to, including Maura Healey.